Well, to discuss the idea of compulsory vaccinations and other issues related to the Delta variant, I'm very pleased to welcome to the programme Professor Christina Pagel. Thanks very much for being with us today. You are a member of the Independent SAGE Group. That's an independent body of scientists in the United Kingdom. First of all, what do you make of this idea of mandatory vaccinations that are being considered here in France? It's not something, as far as I understand, that's being considered where you are in the United Kingdom.
It is. I mean, it has been considered actually here, but so far it's not mandatory. I think, first of all, it's important to understand why people are hesitant about taking the vaccine. And there is evidence that shows that if you address those concerns, which are often very valid concerns, and talk to people about them, that you can then increase vaccine uptake. And I would favour trying that before having mandatory vaccination, because if people are hesitant, then forcing them to do something often just increases that hesitancy and has kind of the opposite effect to what you were wanting.
And we do have, at least here in France, a good degree of vaccine hesitancy, including among healthcare workers. Why do you think it is that there are some people, medical professionals, who are sceptical of getting jabbed? And what would you say to them in order to encourage them to do so?
I mean, there are a variety of reasons for hesitancy, and I don't know what it's like in France, but certainly in the UK, there's more hesitancy among people who live in more deprived regions, but particularly from non-white minority ethnic groups. And often that hesitancy comes from quite understandable reasons, which is a history of racism in the health service, a history of experimentation on people of colour, and also the fact that, in the trials, they're asking reasonable questions like, how many people of colour were in the trials? What do we know about differences between white and non-white people in terms of the vaccine? So there are perfectly legitimate questions which I think people can answer in a way that will persuade people that it's a safe vaccine. But I think we do have to address those concerns respectfully.
Let's talk about some of the measures that are being considered where you are in the United Kingdom. We expect Boris Johnson a bit later on today to suggest that it is more up to individuals to decide how they should behave in relation to the vaccine. One particular idea that I understand we are expecting later on is that Brits will no longer have to wear masks in public, including on public transport. Now, clearly the number of cases in the UK is rising. Are you worried about that?
Yeah, I mean, I'm very worried. Cases are rising a lot. So we're at 30,000 cases a day now in the UK, and we're rising 70% week on week. So that means that in a couple of weeks, we could be over 100,000 if nothing changes that. That's a lot of cases. And we know that masks are effective. And the whole point of wearing a mask isn't necessarily to protect yourself, it's to protect other people. And that's where I think this idea of social responsibility has to come in, and saying it's just about your choice. Well, my choice affects other people. We have things like, speed limits on roads, rules against drunken driving, rules on seatbelts to make it safer for everyone. And I think, this is kind of an analogous situation where I would say, we haven't finished our vaccine program. In the UK, only 50% of the population is currently fully vaccinated. So we're only halfway through. So you're kind of removing any other kind of mitigations. I think it's just too early.
I understand that about 85% of Brits, though, have had at least one, some of them two vaccines now. It sounds like, from what you're saying, that you don't think the United Kingdom is close to herd immunity.
It's nowhere near herd immunity. I mean, if it was, we wouldn't see cases rising like this. And it's not 85% of the population, it's 85% of adults, which is kind of the percentages that the government uses. And that's partly because that's who are currently eligible for the vaccine. But children can get COVID and they can transmit COVID. So if you're thinking about herd immunity, you have to consider your whole population. And so for that, I think it's something like 50% have two jabs. And I can't now remember what a single jab is, but it's something like 60 or 70%. Now, we know that after one jab, the vaccines actually aren't that good at preventing infection with Delta, only about 30% effective. And you really need both jabs to help prevent transmission. And we're just not there yet. You probably need about 85% of your population immune, not just vaccinated, but immune.
And I wonder then, if you were advising, whether it is your own government or the French government, governments here that are tackling this rise in the Delta variant, clearly there is also a pressure to reopen economies. Clearly coronavirus will stay with us for some time. The British health minister made this analogy yesterday, comparing it to flu. What should governments be doing now? If you're saying we should keep wearing our masks, we should keep vaccinating people, in your view, is it possible we'll be returning to lockdowns at the end of this summer? How do you map this out for us?
Well, I think if we do nothing, if we just release everything, it's possible we'll end up with lockdowns. If you want to prevent lockdowns, then you help your vaccines by putting in some other public health measures. Now, masks are one measure. There are other non-restrictive measures. So a really big one that I know some European countries are doing, but the UK isn't, is supporting much better ventilation in buildings. There was a recent article in one of the leading medical journals by a group of scientists where they called for there to be kind of a paradigm shift in how we talk about ventilation. They said, we've got used to clean water from our taps. We should now be demanding clean air in our workplaces and our schools and our buildings, because that's not just good for COVID, it's good for any respiratory illness and respiratory disease. So that's one thing, is a big long-term investment in much, much better ventilation in buildings, and that could have a really big impact on transmission of COVID.
Professor Christina Pagel talking to us there from University College London. Thank you very much indeed for sharing your expertise on the programme today.
Thank you.